This talk earns the lunch for 150 people. I'm sure something new will be there for everybody. This drug is a promising drug in medical treatment of fibroid uterus. In 2005, this particular picture caught the attention of gynecologists. Elephant in the room for a fibroid uterus. Naturally, with this big size animal is in the room, the animal is uncomfortable. And when the animal is uncomfortable, it becomes a troublemaker. So this is all the story of the troublemaker. 80% of the women by the age 50 years will have fibroids. As for the symptoms are concerned, to this August gathering, I don't need to tell that the location is much, much more important than the size and the number of fibroids. We all know that it runs in the family. We also know that the main cause is hormonal imbalance, mainly the estrogen, and now people are talking about progestogens. And lately, environmental factors are also supposed to play some role as far as genesis of fibroids is concerned, like obesity and early menarche. But the literature is flooded now that the progesterone plays a vital role in promoting uterine fibroid growth. It increases the size of the fibroids. Now, as for the treatment is concerned, it's largely surgical. But the quest to do away with the surgery, the medical treatment is sought for. This summarizes both the medical and the surgical treatment. As for the surgical treatment is concerned, we all know about the myomectomy and hysterectomy, both open and by laparoscopic route. We also know certain modalities like uterine artery embolization and a magnetic resonance guided ultrasound surgery for this. As far as the medical treatment is concerned, NSAIDs, tranexamic acid, and OCP, they only take care of the symptomatic treatment of fibroids. As far as the OCP is concerned, you must know that over a period of time, they increase the size of the fibroids. As far as GnRH agonists are concerned, we all know about it that it is very effective, but it definitely decreases bone mineral density, and there are symptoms related to hypoestrogenism caused by this particular drug. Ulipristal acetate has been very, very promising drug, but the safety of this particular drug has been a big question very lately. As far as the guidelines are concerned about the fibroids, the NICE guidelines say that in case of the size of the fibroids more than 3 centimeters, and you are not going to do immediate surgical treatment for this particular patient, then you can use ulipristal maximum of 20 months in 4 cycles. How it acts? It acts by anti-progesterone action, and this came with big fanfare in European countries. It was launched in 2011, and by its merits, it became US FDA approved by 2014. Because of the pharmacokinetics, the special warnings and precautions were issued for patients who are with a renal impairment and for hepatic impairment. But the blow came to this particular drug in 2018 August, when European Union found that 8 cases have been there of a severe liver damage, so much so that they require all liver transplants. At that time, the guidelines were issued that this drug is not to be used unless the person is very, very bad surgical risk, and then also with a very limited few months, and then also the patient should be given a full guidance about it that you are taking a drug for this particular purpose. So one chapter closes, or one door closes, another door opens. Not that low-dose mifepristone had not been there. It has been there since 2005, but now we are going to really talk about this today. It's a promising drug. Again, it acts as an anti anti-progesterone action to stop the fibroid growth. It decreases the size of fibroids. It stops bleeding because it has effect on end arteries. It induces an ovulation, and over a period of time there is amenorrhea. As far as this drug is concerned, since 2007 there are 13 Indian clinical trials, 4 meta-analyses. The first time it was reported in 2009 in human reproduction, and it was thought that 90% of patients will find decrease in blood loss markedly, along with amenorrhea, in good 3 months of time. Then came the report from Dr. Alka Kriplani. This was an ICMR study, again done from All India Institute of Medical Sciences. Again, she said the same thing, that the dose of 25 milligram is very effective to bring down the blood loss as far as concerned, and they land up in amenorrhea in good 3 months of time. Then there have been multiple studies telling the same thing about this particular drug. And then in 2011, you found that Foxy had done a survey of these 11 studies, and Madam Usha Krishna has said the mifepristone did not reduce bone mineral density and does not cause hot flushes, which is very typical of GnRH agonist drugs. As far as it has a potential of clinical benefits prior to surgery also, because it increases hemoglobin level, it reduces the operative blood loss, and so the need of transfusion is not there. It reduces the fibroid size, and the surgery becomes absolutely very easy. In comparison to leupride acetate, you find that the decrease in blood loss of the uterus is much, much more than GnRH agonist. This particular big study again showing this comparison. The only thing what has to be done about this particular drug, that this tablet has to be started, preferably if you start in the first 7 days, it is very effective, so much so that by the end of 30 days you will not have a withdrawal bleeding. But if it is started a little later, and once the dominant follicles are there, then in that particular case you find there can be a little withdrawal bleeding as a result of this. Where can it be used? It can be used in a perimenopausal woman where the menopause is around the corner. There, not only it decreases the blood loss, it decreases the size, and then the patient automatically switches over to menopause. In a younger patient, you find when the fibroid has been there, but it's difficult to approach it hysteroscopically or by laparoscopically, you can give this particular drug. And lastly, whenever you find your patient's anemic, she's waiting for surgery, you can give this particular drug, and the advantages just now I've told you. This thing is to be remembered. The drug houses emphasize lots about it, that it should be started in the first week, but I have used, and it can be started at any phase of the cycle. As far as its effect on the endometrium is concerned, you find in 70% patients, the effect is direct on the endometrium, but it is reversible in good just 2 months of time. Sharing the experience in 53 cases at Life Care Center, where you find 6 out of 53 had been a Life Care staff only, I can say this particular drug has a promise. This drug acts faster, and acts better. Thank you very much.